Hello, everyone. Thank you for joining us this week for Springtide Research Institute's Latinidad, Young People, and Mental Health Week. My name is Dr. Kitia Moreno Garza. I am Springtide Research BIPOC Fellow for this year, and today we're joined by Dr. Fortuna. To start, I would love to have you introduce yourself, Dr. Fortuna, and share a little bit about the roles that you've had and hold when it comes to leadership in mental health, faith, and youth-focused spaces.
Okay, sure. So I'm, Lisa Fortuna, and I am currently, I'll start where I am currently. I'm at University of California, Riverside, where I'm in Southern California, where I'm the chair of the Department of Psychiatry and Neurosciences and a professor there of psychiatry. I am just a little bit going backwards in my background. I'm originally from Puerto Rico, and born there, but raised in on the Northeast in New Jersey and New York. You might hear a little bit of that in my accent. So I'm part of the Puerto Rican diaspora, and so I grew up in that area and went to medical school in New Jersey as well. Always have been interested in medicine and mental health and well-being of the Latino community. And that's really what drove me into really thinking about medicine. And I went through medical school and became a psychiatrist and a child and adolescent psychiatrist. Just to sort of contextualize a little bit of this, the model of really what interested me around religion and spirituality was my grandmother, who is from Puerto Rico, and really raised me with this sense of not only religion, organized religion, but also spirituality and faith, which I think is something that so many of us in the Latino Latinx community have had, is sort of those elders and those family members who really lean in to faith and spirituality as a way of life, culture, coping. And so that always was an interest of mine, even when I was looking at mental health. And so I progressed and went into psychiatry, did residency, and have been working in the public health realm as well, in terms of not only providing clinical care, but have always been interested in public health, or social determinants is what we're really saying a lot lately, of things that impact on mental health of communities. And that led me into public health, and it also led me into the research world. But where did spirituality and religion come back? As I was done with all of that many years of training and research fellowships and everything else, I went back to that core of my grandmother, that was always a thread in the things that I was interested in, really working with community. And also my patients, my families, of immigrant backgrounds, of second generation Latino backgrounds, and from other cultures and countries as well. Religion and spirituality often, if not almost always, comes up in some dimension of the way people talk about their well-being. And I really had become very convinced that, and we see this bear out in the literature, that religion and spirituality, and in particular spirituality, is right on par with our physical health, our mental health. Spiritual health is right there. And so I went into a seminary trying to figure out how to integrate all of those things formally. And midway through it, ended up in the ordination process. So I'm an Episcopal priest in the Episcopal Church USA. I'm still ordained. I still am associated with the Episcopal Diocese of California, and still engage in that in different ways. So that's a little bit about me. I come from a progressive, less conservative perspective, to be in full disclosure. I'm cisgender, she, her, hers, identify with the queer community as well. So, how that integrates all in terms of religion, spirituality, and identity and culture are things that I'm very interested in as well.
Yeah, it sounds like for you, your history and upbringing and the elders in your life were really instrumental in you practicing at this intersection of Latinidad, mental health, religion, and spirituality. And one of the things that you touched on, which our research found too, is that a lot of these pieces are really intertwined in the way that they impact mental health. So one of those things being that for the kiddos that I say kiddos, but our 13 through 25
Yeah.
that we surveyed, about 53% of them said that their religion and their spirituality really mattered for their mental health. That it was something that was really important. And 63% of the people that we did survey that had seen a mental health professional didn't feel like that identity and that topic was something that was touched on. The religion and spirituality weren't something that were explored. Why do you think in your work that you've done, being on both ends of this, right? Being a reverend and being a psychiatrist, why do you think it's important to discuss spirituality and religion when it comes to mental health for Latino young people?
I think it's really essential for doing that with Latino youth. I actually believe it's important for all people. I think we all have some realm of spirituality. I think, it's unfortunate, just to speak a moment about the 63% that said, no one even brought this up in therapy, is, in our training, to be frank, in mental health, is not something that is adequately covered. I often do lectures where residents and people in training in mental health, and they have lots of questions themselves about how to integrate that because they've never really had that topic sufficiently addressed. And so I think, providers across the mental health professionals, most do not feel comfortable asking. It feels like a touchy subject for people. They feel like they're moving into area that's not in their expertise. And if things come up, they're not sure quite what to do about it. And that's unfortunate because it is so integral. In some of the ways that I'm able to bring this up in the therapeutic context is to ask the questions. And that's what I tell the mental health trainees and learners that I work with. You can ask questions around do you have a faith that is important to you, or to your family, or a faith tradition that you've grown up with that you think has influenced how you're thinking or seeing things right now in your life. Is there a spirituality or practice that you lean into for coping, for sustenance, and then also, are there some challenges that you're experiencing in your life in that regard? Because we know that we can sometimes really wrestle with some of the dogma and the belief systems, right, that we have grown up with and that we may not necessarily agree with. And there's sometimes some tensions, right, that can really result in some stress and some family conflict, which we know is not very good either for our mental health and well-being. So, and including with queer youth, LGBTQ youth, who often, I think some of my colleagues feel like, well, of course they don't want to believe in that faith anymore because it's not affirming. But that's a very critical issue to talk about. Youth who are coming out and who may be having tensions with their families around their sexuality or their gender or identity, and how do they reconcile that conflict with their family and their own internalized belief systems that they are trying to reconcile for themselves, right? And so there have been many, many instances where when I brought that up, it was at the core of the mental health tensions. And that's why I think it really is something that we have to talk about more in therapy, and a tremendous missed opportunity when we don't ask about it.
Yeah. What do you think is makes it? I think I'll backtrack. My experience has been similar to yours, and that being in a medical setting, having exposure to other therapists, to medical students, to fellows, to residents, it's something that sometimes doesn't even come into the room until we ask about it in a training setting, right? What do you
Mhm.
think makes it so what makes this a challenging topic? Because I think sometimes even when we do the conversations and the lectures, I hear back like nervousness around bringing this into the room, bringing this topic at all. What do you think
Mhm.
it is that makes this a challenging topic for trainees, but professionals that are already practicing too? to introduce the conversation around religion and spirituality.
Yeah, it's interesting, right? It's almost like if you talk about religion, you're talking about sex or something, right? Which we're a little bit more comfortable talking about,
Yeah.
I think, than religion. And I think there is some historic threads there where if we're going back to sort of Freudian conceptualizations, which I think, we're becoming a lot more diverse in our orientation than that, at least in psychiatry and always has been in psychology. The Freudian thread is that there's something uh, primitive
Mm,
about religious, spiritual orientations of thinking about things, right? And that there's also some sense of, that, providers, psychiatrists, are more, advanced than that and more scientific than that. And to think about religion and spirituality is not really sort of leaning into psychological frameworks of mental health. And I think for a long time, there's been a, push to not go there and not to sort of really focus on that. That is getting better, but I think it's still present. And, I'm pretty convinced that's still present in some way because when I also talk about it, I constantly see trainees saying, wow, we don't know how to do it. And, how do I know I'm not like crossing boundaries in asking about religion? And, what if they ask me if I believe in God and I don't, what do I do then? And it just seems like it's something very personal and intimate that we're not supposed to talk about, which is interesting because we talk a lot about many other intimate things in therapy, right? But it seems to be this area where we just feel like, that's for priests and pastors and ministers to talk about, and it's completely out of our field.
yeah. One of the things that you're touching on, I think, is something that we ran into as we were trying to create this week of really highlighting Latina mental health, which was that there's like certain kinds of knowledge that are appropriate and that are valued more than other kinds of knowledge,
Mhm, mhm.
which is like this research based, evidence based, like this is what's scientific, right? That Freudian piece, and how other ways of knowing are less valued. But I think culturally, like obviously Latinidad is not a monolith. There's so much diversity, but there's so many ways of knowing that are cultural, right? That are passed down, that are spoken. How lived experience is so important, and that's not always what's valued when it comes to being in academic spaces, when it comes to being in medical spaces. What's been your experience of kind of how that impacts patient care when it comes for client care when it comes to exploring all of a person, including religion and spirituality in clinical spaces?
Yeah. No, I think, as I was mentioning, it's a tremendous missed opportunity to not ask about it. I have had clinical situations where just thinking of one adolescent who kept having a depression that was not getting better, even when I was doing, evidence-based treatments, cognitive behavioral therapy, we were even thinking about, medication. She just wasn't getting better. And, when I finally really asked her, because I'd asked her before about any sort of spirituality, faith, I said, I asked her again, I really mean it. Like, is there anything else going on? And she said, you know what, I'm scared to tell you because you're gonna, say I'm crazy. And I said, no, I haven't had no other indication that you're, psychotic or anything else like that. So, tell me, and she really started to talk about, things that were much more in the spiritual realm. Immigrant young woman who, started to have, ideas of visions of someone who had passed, right, which was very, culturally aligned with, her background, and how she was struggling with the loss of this person and the experience she was having in these visions, and a lot of guilt and other things that were sort of manifest in there. And when we finally got to that, it's when she really started to improve in her symptoms because it was just something that was weighing on her so heavily. And if I had not asked those things, she would have kept going on with whatever I was doing and, whatever, and maybe not have gotten better or having to really take a much longer time to really get to that issue.
Yeah.
And I think that the power of doing that is also the concern that I think therapists who might not feel as comfortable and as trained in doing that is like, how do I talk about visions?
Mm,
Right. And that's why I think, we need to have more training. And
mm,
also in our field, we have, this idea of cultural formulation, right? Like, how do we ask the patients about their cultural perceptions of things, their cultural support systems. Um, how does their culture relate to their explanatory models of what's happening to them? We have that in our diagnostic manual, right? And been integrating that for some time. And I would say spirituality is right there because, as I was mentioning, spirituality, religion is it's a social construct, right? It's sort of where is our social support? From who do we come from? Who has influenced us? It includes religion and spirituality. It's an identity construct, and it's a human well-being construct, right? And right there with biology and psychology, and we can ask questions about that from all those perspectives
mm.
as well for spirituality and religion.
Yeah. One of the things that we know is like Latinidad is very diverse, right? What is true for one group will not be true for another group. And I'm curious if you could share a little bit more about how, if at all, like factors like immigration, right? The story that you just shared, factors like immigration, race, gender, identity, religion, how those shape mental health for Latinos.
Right. And those things definitely shape the mental health for Latinos, and also where religion and spirituality comes into that too, right? So, I told you one story, right? But I have many immigrant communities that I have worked with, Latino and other, where refugee experiences, political violence experiences, other significant traumas in the immigration process, that religion and spirituality are at the heart of enduring and coping and making it, right? Sort of, and it can go as deep as, how prayer helps, as well as this sense of God's accompaniment of people who are oppressed, right? Which is, and ritualization of that, right? In terms of when people are crossing the border and have rituals and prayer around that, and use symbols of crosses of people who have been oppressed and killed. And so there's this real sense of in Christianity, in the Christian tradition of a God who has suffered with us, right? And came for the poor and the oppressed. And that is a real and living construct because, there are many immigrant young people that I've talked to that I've asked, how did you endure that? How did you endure the gang shooting at you? And, and they talk about, faith and values that have been passed on by caregivers, including grandparents, and how that sustained their endurance of resisting doing the wrong thing. And also how they have a very liberation sense of, Christ, right? And they'll talk about that. And that's literally how they operate and endure. Um, so that's one way that it can happen, right? I think in, more acculturated, or say even sort of young people who are born here, I think we still have the cultural influences, right, of our parents, of our grandparents, and reckoning with that. And so what I have found, for example, in the Episcopal Church is just one example, right? One very sort of, singular example, is that we were having a hard time having Latino youth sort of, join the church, right? Like the church is aging, and they, young people, weren't coming. And in some instances, we had sort of really great youth ministries. And the places where that really worked was where there was a lot of openness to talk about social justice issues along with faith and religion. What is an affirming faith across identities? Like that's really what that next generation, a lot of them were interested in. They were saying, we like the idea of faith and religion as, our like parents and grandparents, but we want something more. Like it needs to do something in the world. Like we're having a lot of challenges in the world. It needs to do something more than just come on Sunday and pray. And that's what we were hearing from young people. And so we created a lot of ministries that were related to that. And it even moved into the secular world because, I was part of one organization, Episcopal City Mission, which is in Boston, which does a lot of funding and community organizing around social justice issues in the Boston area. And at first it started with church affiliated, youth programs and groups, and then expanded to secular community-based organizations. And then, and we were saying, oh, we shouldn't talk too much about faith and religion, right, in terms of the secular groups. And they were saying, no, talk it, sort of, live into sort of where you see faith and religion, manifesting in social justice movements. And a lot of Black Lives Matter has a very sort of, spiritual thread and, really sort of leaning into ancestors and the power of that. And, so it has a thread in the political realm too, an organizational realm. So I don't know if that answers your question, but it because spirituality and religion is so complex, it's a personal thing, it's an individual thing, social political thing, that it can manifest in all of those ways in terms of how our diverse Latino, and Latino diaspora have experienced it, right? And are playing with like, how do I see it? How do I integrate it into what I want to do?
Mhm. I think in that same realm, one of the things that we've seen is that when young people are struggling with their mental health, sometimes it's a faith leader that they have found that is someone that has listened to them, someone that has made
Yeah.
space for them. And this might be one of the first people that they feel is a trusted person they can share with, that something is amiss, right? Something is not feeling okay, that they're struggling.
Yeah.
And sometimes we've heard from faith leaders that say, how do I know when this is like spiritual guidance and I'm helping, and when do I know to refer out to a mental health care practitioner? You're in the unique place that you've practiced as both, right? And can you speak to how how do faith leaders know when is this kind of an issue of me providing spiritual guidance? When is it best to refer out to a mental health practitioner?
Mm-hmm. Yeah. So, you're talking about something really, really important. And even though I'm a priest and a psychiatrist, I've always tried to keep things separate, right? Because there have been times where I've been 50% in a clinic and 50% in a church.
Mm,
And with Latino communities, almost always in those two contexts. And so the first thing I'll say is there's a need for mental health support in both places. People definitely look to their pastors and priests for spiritual support that for things that may be more in the mental health realm,
mhm,
like depression, experiencing domestic violence,
mhm,
anxiety, stress, substance use, right? And people will reach out to those ministers and ask for support and guidance in that. A lot of mainstream denominations, including the Episcopal Church, will say you can provide support and guidance in that way for about 3 sessions of sort of hearing and ascertaining what the needs are, providing what might be spiritual guidance in terms of reflecting on God in a person's life and what might be some of the spiritual needs. But then once you see, that there are additional needs, like the person is experiencing a depression or suicidality, that you have to be clear that you need to refer. And so some denominations actually have an ethical guideline around that, right? And there's a few reasons for that. One, we want to stay in our lane. And as pastors on the pastoral side, provide support, open up, open communication, be able to talk about mental health. Like I've done workshops in churches to talk about youth mental health, suicide prevention. How do we sort of do suicide prevention in the church? And there's some churches who are even providing like support groups for people because the church is the place where people trust with the collaboration, right, of a therapist because it's a great site. So it could be a great site for that. But the collaboration and working within our professions, right, and collaboratively when needed is really great. And that's what I tell the mental health providers too, right? Like if you are, I remember we were talking about this fear of like, oh my God, I can't like answer all like the religious spiritual questions. You don't have to, right? Like you're exploring how this impacts the person's health and mental health. And then when there are real questions around belief systems, how do I reconcile this, doctrine versus others, or, how do I think about, sin, then, you want to go with the pastor, right, to sort of support you in working with that. And I think where we're really sort of making some gains is that more and more faith communities are feeling comfortable about talking about mental health. And that's a bit of a breakthrough, right? Because, there has been some divisions on both sides and talking about sin and versus a mental health or a biological condition, right? Like, for example, in addictions.
Mhm. Yeah, one of the things that you mentioned is kind of things that you give mental health care providers to think about when it comes to introducing the conversation around religion and spirituality into the room. What do you wish more mental health care providers knew when it comes to working with Latinos, specifically like Latino, Latina children and adolescents?
Right. Especially around that religion and faith
Mhm.
components too. How integral it is to our lives, right? I mean, I think, again, you talked about how diverse we are, but, I think there are very few Latino communities that don't have some religious faith tradition, right? And including the diversity of not only sort of Christianity, but indigenous belief systems, right? And spirituality and practice, which, a lot of the communities I'm working with who are trying to find healing around trauma in the community are trying to bring back into the lives of young people, right? And sort of reconnecting and identifying what indigenous spirituality and practice, right? And therefore identity. So I think that's one thing to sort of, the providers really need to have a curiosity and an exploring, right? And not too quickly stereotyping what does it mean to be spiritual religious, right? Having a curiosity to ask, what does that mean for you?
Mhm.
How does that play out in your life? Even if you think the young person is like secular and they're not going to be like, down with any of that, it's still there because it's so also culturally integrated, right? It's so for centuries, right, been integrated with our culture, right? Including colonization, right? And so it's ever present. Even when I talk to young people, I remember she was sort of making some clear plans for her life. And she said, si Dios quiere, right? If God wants, right? And she's like, my grandmother always said I have to say that. And I said, my grandmother always said I had to say that too, right? Like we can never be so bold to imagine that we hold the full control of our destiny, right? That it is if God wills. And that might seem a very subtle thing. It's very integrated culturally for a lot of us, of the, how do we see life, right? Like, where's God's like, providence in that? And, fatalism, right? Like, are there things that are destined? And some of those things we grapple with as we get more acculturated, but those things are present, and they do have an impact on our worldview, culture, and therefore, how we psychologically process things in our lives.
Mhm. Yeah, I think you're making such a great point in that these are things that can't quite be divorced from who the person is, right? Big pieces of spirituality and religion are embedded into our culture and how we move through the world. When it comes to mental health providers, you had some really great kind of things to be in the forefront of their mind. When it comes to faith leaders, what are some recommendations, advice that you have for them for serving Latino and Latina young people and supporting their mental health while also acknowledging their culture as a piece of that?
Yeah. So I think there's several things that could be offered as faith leaders. One is if you have a significant amount of young people, anybody, but definitely with young people, have a good partnership with a psychologist or, or therapist, mental health providers, who are interested in partnering. And there are a lot, right? I get a lot of people on that side saying, how do I partner with churches and things? You know, if there's an opportunity to sort of reach out, if nothing else, you need a good referral source that you trust, right? When you feel like something mental health here, who do you trust, you know, to hold in good care the your people in your congregation, right? Have build a relationship with them so that they know that you are there to support on the pastoral and the social support pieces, that you're a resource for them as well, as needed. But you have those places where you can do, and then you can also do a lot of collaborative prevention work. Churches are great places, as I was mentioning earlier, where you know, you can have workshops on, you know, suicide prevention, because a lot of churches do grapple with, you know, the concern that young people doing self-harm or suicides that happen, depression, anxiety, you know, all of those things. And you can hold forums work with in combination with psychologists or mental health providers and actually have sort of ways of how do we bridge an understanding of our spirituality and our mental health and how do we think about both, you know, together, can be a really powerful thing for young people. And then the other thing is, you know, really, you know, having a, you know, there are trainings for for pastors around the country, and you know, to be look, you know, look locally around at least understanding some, you know, some good mental health practices for those interactions that you do have on the onset, you know, before you refer, you know, how do you sort of attend to, you know, different things and talk about mental health topics with communities. I think all those things, you know, allow us to partner and being able to support.
Yeah, it really sounds like at the heart of your advice and recommendations is the importance of connecting mental
Mhm.
health providers with faith leaders and opening up the line of communication there.
Yeah, exactly. And the faith leaders also can be a resource for because you know not everybody is on the mental health side, feeling that, you know, comfortable with spirituality and religion. I'm hoping we're sort of getting more at it. And there's also the cultural context, right? So pastors, you know, are often, you know, they are embedded at least in the culture of the community, if not themselves from that community. And they can also help bridge cultural understanding of that community, right? They can be cultural brokers, so to speak.
Yeah. Well, this conversation has been really helpful for kind of getting an insight into how that connection can happen between mental health providers, faith leaders, how they can each support each other, and really tapping into your knowledge, being at the
Yeah.
intersection of both of those pieces. How can people continue to connect with you and the work that you're doing?
Okay, so I'm on LinkedIn. It was Lisa R. Fortuna. I was on Twitter a little bit less lately, but that is at Fortuna_Lisa. You can still kind of find me there. And I also have a website, Lisa Fortuna MD. And yeah, and you know, I'm happy to sort of, you know, have people sort of link up with me, especially in LinkedIn. I'm a little bit more time on there lately. And I'm always interested in hearing how people are integrating mental health and spirituality. I think there is a definite interest and need, and you know, often we're seeking each other to learn more, especially those of us who want to integrate those things.
Thank you so much for joining us today, Dr. Fortuna. It was wonderful speaking with you.
I thank you. All right.